This is a short video to present the home health visit to our patient who has the condition Myasthenia gravis. This home health visit was conducted by Jessica Coleman, Laura Schuster, and Taylor Strohmeyer. During this video, we will briefly describe what Myasthenia gravis is, how it affects the patient's daily living, what medications they are currently taking, and information on resources available to patients that we were able to offer to her. We began our home health visit with a safety check of the house. Everything was in order, and since our patient is only 28, there were no safety risks that could lead to falls or any other harm.
Myasthenia gravis is a chronic autoimmune neuromuscular disorder that is characterized by fluctuating weakness of the voluntary muscle groups, such as the arms and legs. Symptoms can include blurred vision, double vision, drooping eyelids, a feeling of extreme tiredness, and shortness of breath. The patient was first diagnosed with myasthenia gravis in January of 2014. Since her diagnosis, she must visit the doctor every 6 months, have a CT scan done yearly with contrast, and a chest scan done every 5 years. She must also be screened regularly for any signs of a development of a thymoma. The patient now has to have greater caution when taking medications and inform every medical personnel that examines her for any reason of her diagnosis. Some other changes that she has had to take since her diagnosis are increased exercise, avoiding driving at night or when she is extremely tired, and greater precautions are necessary during her pregnancies since her diagnosis.
Our patient has delivered 2 children and was currently pregnant at the time of this home health visit. Her first child was affected by her condition because at the time she was unaware of the disorder. This child was born with muscle fatigue that lasted for about 2 weeks. He could not eat well. He had a decreased blood sugar and an increased bilirubin level. Before the birth of her second child, our patient was diagnosed with myasthenia gravis and was able to discuss a second pregnancy with her neurologist and OBGYN. The second child was then delivered in the NICU. Other differences made to her condition by this third pregnancy included a temporary remission of the disease because the pregnancy had shut off her immune system. She must also stop taking her medications during this time.
The patient was currently on 3 medications at the time of our home health visit. Metoclopramide was prescribed for the prevention of nausea and vomiting associated with pregnancy. Pyridostigmine was prescribed for increased muscle strength related to myasthenia gravis, and the last medication was an over-the-counter prenatal vitamin. Metoclopramide is a 10 mg tablet taken by mouth every morning to help decrease the symptoms of nausea and vomiting that occur with pregnancy. This medication is most effective when taken before symptoms occur. Pyridostigmine is a 60 mg tablet taken by mouth every 4 hours. It is used to treat the symptomatic decreased muscle strength caused by myasthenia gravis and is an anticholinesterase drug. Because our patient was pregnant, this medication was discontinued for the entire pregnancy due to the increased uterine irritability after IV administration when the patient is near term and the risk that the newborn will display muscle weakness after delivery. The last medication is an over-the-counter prenatal vitamin taken once daily to provide adequate vitamins and minerals needed during pregnancy, such as folic acid to prevent neural tube defects and iron to prevent iron deficiency anemia.
Because this patient was very well educated with her condition, very little further teaching was needed. However, we were able to provide her with information regarding some resources in her area for patients with myasthenia gravis. These are some of the resources we were able to provide to our patient.
One of these resources was regarding a statewide meeting of the Georgia State chapter of the Myasthenia Gravis Foundation, which meets on the first Monday of every month. This website also provided information about her condition, for example, the drugs to avoid, and also video recordings from the past meetings if she was not able to actually attend the in-person meetings.
In conclusion, this patient was very well informed about the signs and symptoms of her condition, the pathophysiology of myasthenia gravis, when and where to seek further help, and the importance of maintaining a regular medication schedule. We were very glad we were able to offer her further resources that may help her as she continues to manage her condition.